It does seem counterintuitive when an individual is really tired, and as a cancer patient, you are struggling with a lot of side effects and toxicities and things to manage as you are managing your disease. You're trying to complete your chemotherapy, your radiation therapy, you're taking your hormones and your immunotherapies. There's a lot to manage. However, exactly what you need to do is make sure that you get up and move around and stay active. The number one thing that we can see that happens if patients don't actually think about exercise and follow a real exercise prescription when they find that they have a diagnosis as they go through treatments is that your activity declines, and as your activity declines, all of your cancer outcomes are poorer. And this is also associated with a poorer prognosis. So if you can actually maintain your physical activity levels or increase them, you will have much better outcomes in terms of your toxicities as well as the cancer itself. What you need to do to find a way to get the right exercise prescription and the help you need, I would first start by striking up a conversation with your oncologist. You want to find out from your oncologist not only what might some of your cancer limitations be, but you want to look at your whole health spectrum. So in addition to your cancer, do you have any heart disease? Do you have any lung disease? Do you have any other complications with your bone health or your metabolic health like diabetes that you need to be aware of as you begin an exercise program? Then you want to have your physician work with you to find a credible exercise professional. This can be a physiotherapist, an exercise physiologist, but it needs to be a credible trained professional who can help with assessing your baseline levels of fitness and activity and well-being, and prescribing an appropriate prescription, helping you implement it, and then monitoring it. Many patients think that they could just simply do this on their own, but we know in fact that the uptake and the adherence and the actual prescription's efficacy is much improved if you work with a professional. We see in the data that medication adherence is often frequently low, sometimes in the neighborhood of 50%. So we know that even though we think it's easier to take a pill, patients don't necessarily prescribe to pharmaceutical prescriptions any better than they do to many behavioral prescriptions. What's key about adherence to an exercise intervention is that the prescription be tailored to appropriately meet the patient's goals. So I'll give you an example related to fatigue. If a patient is really suffering from mental fatigue or cognitive impairment, which is often linked with mental fatigue, and their primary goal is to reduce that mental fatigue, then I do not need to prescribe them exercise at a level to improve physical function or other types of fatigue, such as physical fatigue. I can get an improvement in mental fatigue with as little as 10 minutes a day of activity. So if the goal is mental fatigue and I prescribe 10 minutes, it's much easier for that patient to adhere to, especially when they're sick, they don't feel well, they're undergoing chemotherapy and radiation, versus if I were to say to them, you need to do 30 minutes a day of exercise, when in fact they don't. So a key is to balance that in terms of the prescription. That will help with adherence. Make sure you target the cancer-specific outcome they're interested in. And also, we promote many different modes of activity. So choosing a mode, whether it's walking, yoga, swimming, other kinds of things that the patient likes and is interested in and can easily access is important.